All right, we're diving into diabetes management today with drugs and diabetes. Looks like you're going straight to the source with this one and not just skimming the surface. This is a whole textbook you're digging into. What I like right off the bat is it's not just here's the meds you take. It gets into the why, which is huge.
It really is. And that's where that whole patient-centered approach comes in, which this book is big on.
Yeah, what does that even mean, though? Patient-centered. It's got to be more than just a buzzword, right?
It really is. It's about recognizing that your diabetes management, it's not one size fits all. We're talking about your lifestyle, what other health stuff you've got going on, what you're comfortable with, even financial stuff, all that factors in.
So it's like instead of just, here's the guidelines, good luck, it's more like, let's build your plan together.
Exactly, because what works for one person might not work for another. And that's where getting into those specifics, like this book does, is so key.
And you clearly want to get into those specifics. I mean, you dug right into the ominous octet, which, by the way, sounds kind of scary. 8 different body systems affected by type 2 diabetes. So it's not just about your blood sugar.
Right, it's much bigger than that. Think about your heart, kidneys, your nerves. It's about the long game, protecting your health down the road.
Which makes sense. Why just manage when you can try to prevent bigger problems?
Exactly. And that's where understanding those medications comes in, because they all work in different ways.
Yeah, you've got your metformin, which the book talks about as a common starting point, right? So it helps your liver with how much glucose it's putting out. Makes sense. But like you said, it's not for everyone.
No, not at all. And that's what I think is so cool, how this book gets into those other options, like those GLP-1 receptor agonists.
Those are wild. They do like a million things at once, impacting insulin, how fast your stomach empties, even appetite. It's like the multi-tool of diabetes meds.
They really are. And then you've got the SGLT2 inhibitors, which are newer, but they've been shown to have benefits beyond just glucose control. Like we're talking heart health, which is huge.
So it's not about memorizing every drug name, right? It's more about here's how these things work in different parts of my body.
Exactly. Knowledge is power in this case. The more you understand, the better you can advocate for yourself and work with your doctor.
And this book is all about that. It even goes into all these different patient profiles, like what if you're overweight or you're prone to hypoglycemia, kidney problems. It's like they were reading your mind.
And that's what I appreciate goes beyond just the general stuff. Take the example of someone who's overweight or obese. The book points out that some common meds, they can actually cause weight gain.
Seriously. Talk about frustrating, like you're fighting an uphill battle.
It is, and it highlights why that individual approach is so important. In those cases, you might look at those SGLT2 inhibitors we talked about, or GLP-1s, because they can be weight neutral, or even promote weight loss. And that ties into another thing the book emphasizes. Even small amounts of weight loss can make a huge difference.
Oh yeah, that 7% figure from the diabetes prevention program, that stuck with me. Big changes aren't always necessary to see results.
Exactly. And it's not all on your shoulders either. We're talking about finding exercise that works for you, especially if you're older and maybe have some limitations.
Makes sense. You want something that's actually doable, not just some ideal that's impossible to reach. Now, this next part can be tough to talk about, but I'm glad this book doesn't shy away from it. Cost. As someone who's felt that pressure of medication expenses, it was good to see them be real about it.
Oh, absolutely. And the good news is there are ways to manage diabetes effectively without going broke. The book talks about older generic meds like metformin or even choosing vials of insulin over the pens, things like that.
So it is possible to have both. Effective treatment and something you can actually afford.
It is, and that's where that open conversation with your doctor is key. You can find that balance together.
It's such a relief to hear that because sometimes it feels like, oh, you can't afford the fancy stuff. Too bad.
No, not at all. And that's the beauty of knowledge, like we're getting from this deep dive. It arms you with the information to advocate for yourself and really be a partner in your own health.
Exactly. You're not just along for the ride. You're in the driver's seat making those decisions.
And that's what it's all about.
Speaking of being in the driver's seat, this book doesn't shy away from the kind of scary stuff either. Like it connects all of this back to preventing those long-term complications. It's not just about managing diabetes now, it's about protecting your health down the road, right?
Exactly. And those complications are nothing to scoff at. We're talking about heart disease, kidney problems, nerve damage, even the risk of amputation in some cases.
Wow, okay, definitely not messing around. But I appreciate that the book doesn't just like list those and leave you hanging. It talks about what you can do.
Absolutely. Like blood pressure control is huge.
Yeah.
And the book gets into the medications that can help with that, which is super helpful.
It talks about statins for cholesterol, too. But it's not just like statins good. It talks about who really benefits, potential downsides, when you might need something else. It's very, here's the whole picture.
Exactly, because everyone's different, and there's no one-size-fits-all solution.
Okay, speaking of different situations, can I be a teeny bit of a downer for a second? All this talk about medication got me thinking about side effects. Because having all these options is great, but are there downsides? Asking for a friend, who's totally me.
Haha. No, that's a really good question, and honestly, one that more people should be asking, and this book does touch on that, emphasizing that close monitoring is key. Often there are ways to manage or even minimize side effects, but you have to be aware of them and speak up.
There it is again, that open communication with your doctor. It's like a broken record, but in the best way possible.
It really is about that partnership, that dialogue between you and your healthcare team.
Not just showing up and being told what to do, but actually being heard.
Exactly. And the more informed you are, the better equipped you are to have those conversations.
Which is, I think, what we're really going for with this whole deep dive thing. Giving you the knowledge to be your own advocate.
100%. It's about empowering you to take control of your health, make informed decisions, and really own your journey.
Love it. Okay, before we move on, is there anything else from this section of the book that really stood out to you, something our listeners should keep in mind?
You know, one thing that I found particularly fascinating was the discussion on the gut microbiome and its potential role in diabetes management.
Oh, yeah. It even talks about how metformin, which we talked about earlier, might actually work partly by influencing the bacteria in our gut, which is wild.
Right. It's like this whole other layer of complexity that we're only just beginning to understand.
And it makes you wonder, what else is out there? What other discoveries are waiting to be made? It's exciting.
It really is, and it just goes to show diabetes research is constantly evolving, and staying informed is a lifelong journey.
Absolutely. Well, with that in mind, let's take a look at another section of the book that I know will be of interest, especially given your desire for a personalized approach to diabetes management. It's like, diabetes research is never done, huh? Always more to learn. Which, speaking of learning, there's this other part of the book I think you'll appreciate. It gets into the challenges of managing diabetes when you've got other health stuff going on, too.
Oh, yeah. Because it's rarely just diabetes in a vacuum, right? Most people are dealing with multiple things at once.
Exactly. And this book gets that. It doesn't pretend it's simple.
It talks about how important that integrated care is, how managing your diabetes can affect your heart, your kidneys, even your mental health. It's all connected.
It's like you can't just treat one thing without thinking about the rest. It's all part of the same body.
Right. So working with your doctor to create a plan that takes everything into account, that's crucial.
Makes sense. And while we're on the topic of connections, the book talks about social support too. Having family, friends, or even support groups can make a big difference.
Yeah, it's easy to forget that part. You're not alone in this.
It's like building a team. Your doctor's on your team, the people who support you, and you're the leader.
Absolutely. And with everything you're learning from this book, you can be an informed leader.
Ready to advocate for yourself and make those decisions that are right for you.
Exactly. It's about taking ownership of your health journey.
Well said. Wow, we covered a lot today. It's amazing how much there is to think about with diabetes management.
It really is a complex landscape. But like you said, knowledge is power. And I think we unpacked a lot of valuable insights from drugs and diabetes today.
For sure. We talked about how different medications work, why that patient-centered approach is so important, the role of lifestyle, cost considerations, even the gut microbiome.
And let's not forget about those long-term complications. Not just how to manage them, but how to prevent them in the first place.
Right. It's about taking that proactive approach, being informed and empowered to make those healthy choices.
Absolutely. And remember, this deep dive is just the beginning. Keep learning, keep those conversations with your healthcare team going, and keep advocating for your health.
Couldn't agree more. To our amazing listeners, keep those questions coming, and until next time, happy diving.